So lupus is an autoimmune disease. People ask, what does an autoimmune disease mean? And it really means, in general terms, that the body begins attacking itself. And that can happen in many different ways. And I know Dr. Jeffries will talk about this today too, how the disease is really multifaceted and really heterogeneous. So everyone living with lupus or everyone living with a type of autoimmune disease has a slightly different experience. That's what makes it very difficult to treat. And it also makes it very difficult to live with because you never really know what you're going to expect. There's going to be trends. In thinking about lupus itself as an autoimmune disease, it predominantly impacts women. So 9 out of 10 people living with lupus are usually women, and predominantly women of color. And so when you think about treating the disease and who's living with this experience, you ask how it's affecting the Black community. Those women of color not only have a higher prevalence and presence of lupus, but a higher severity of lupus. And so when we're thinking about developing care plans, when we're thinking about studying the disease, when we're thinking about participation in clinical trials, it's imperative that we're evaluating lupus, we're describing lupus in this population.
I think for women of color, there's other aspects of lupus and of that affect the community in different ways. And so, one thing that patients with lupus are very prone to is exposure to sunlight, and basically that can trigger flares, can trigger rashes, and can worsen the disease. And we have great products for women, for white women, to help them basically mitigate that and prevent some exposure, but also maybe to kind of yeah, well, so we're just lacking those sort of products, I think, for Black women.